Obsessive-compulsive disorder, also known as OCD, affects approximately 2% of the world's population, affecting 1 in every 200 children in the US. People with OCD often suffer from leaving rituals. This can include the constant switching on and off of the cooker or light switch, or counting the steps when leaving the house. A lot of people with OCD have a phobia of germs, which can result in constant washing of the hands. However, being overly cautious about the cooker before leaving the house or having a high level of hygiene does not necessarily correlate to having OCD. Some sufferers are often submerged in dark thoughts, consisting of committing terrible crimes such as murder, rape, and even child molestation. Even though the person would never carry out these actions, they are in constant fear of doing so, and in some circumstances, the person does not want to be around knives or children, as it can exacerbate the negative thoughts which they fear may spiral out of control. Many people with OCD often are aware that the obsession and compulsions they experience are irrational, however, do not have the ability to control them. A person does not need to experience both obsessions and compulsions. They could just be experiencing either one. However, majority of the people with the disorder are subject to both. Compulsions are usually carried out in order to alleviate the anxiety produced by the obsession, such as the compulsion to arrange things in order, which can cause anxiety if the objects are left unarranged. Repetition can also be a form of compulsion, like switching a light switch on and off a number of times, or knocking on a door with a precise number of knocks. This sort of obsession stems from the person feeling incomplete if they do not carry out the action a number of times, and in some cases can believe if they don't, it will bring some form of bad luck. OCD can be very time consuming and can majorly impact one's social and work life. The causes of OCD are unknown. Like many mental disorders, it is thought that genetics and environment play a role. OCD can run in families. Identical twins are more likely to be affected than non-identical twins. Certain regions of the brain are associated with the disorder, along with low levels of the neurotransmitter serotonin. Serotonin can control a person's mood, appetite, sleep, and even pain. Psychotherapy can be a form of treatment. This form of treatment can in some instances allow the person to understand why they have erratic and dark thoughts, along with the distrust that they would carry out terrible actions. Often enough, these thoughts stem from low self-esteem and self-loathing, which therapy can help break down these issues. Other forms of psychotherapy can involve a technique called exposure and response, where the subject is exposed to a compulsion and does not carry out a response, showing that the anxiety can alleviate if they do not carry out the compulsion. Another form of treatment is known as deep brain stimulation. Electrodes are implanted in the brain. When they are activated, they alter the brain activity to similar activity of a person without OCD. Patients who have undergone this treatment have claimed that they have better mood, confidence, self-esteem, and an overall better quality of life. Medication that increases the concentration of serotonin can be given by limiting the reabsorption of serotonin by brain cells, which helps reduce the symptoms of OCD. However, in some instances, this form of medication can cause side effects. With a better understanding and the right treatment, or the right combination of treatments, can offer a person with OCD a better quality of life. Thanks for watching. Don't forget to like, comment, and subscribe.